So, what effects do weighted blankets actually have? Well, in this video, I'm going to go over a bunch of information that I've found scouring the internet for research papers that actually have some provable information on weighted blankets, as long as what a lot of experts tend to think that they do, even in the absence of a lot of finite information. So let's move on with it. So the definition of a weighted blanket in the terms that I'll be using it is a blanket that weighs about 15 to 25% of your body weight. So in the community, the most commonly used way that people use weighted blankets are to help with anxiety issues, help with sleep disorders, ADHD, ASD. They give a continual stimulation, a deep pressure therapy, blood pressure regulation, heart rate, and they're a way of not having to use medications to improve your sleep. So going through some of these research papers, I have them linked below and you can check them out in any of their reference texts. The first paper I'm going to be talking about here goes deep into ADHD regulation. It's a non-pharmacological intervention, which means they don't have to use drugs for it. They did it with 100 children aged 6 to 13, 4 weeks long. They did this test, and they're all people who were recently diagnosed with ADHD and had current sleep disorders. So they did a randomized placebo-controlled crossover trial, and they had children that had sleep problems and recently diagnosed ADHD, included but not limited to bedtime resistance, night and early morning awakening, and then co-sleeping issues. If you'd like to read more in depth, the study will be linked below with 63 supporting documents, and they go very in depth with many different cofactors, including participant and parent interactions, preference biases, autism spectrum disorder versus ADHD, and more. But they pretty much found that using a weighted blanket for most cases did help with bedtime hygiene and did help with overactivity when people on the ADHD spectrum. The next big paper we're going to be talking about was the effect of a 30 pounds weighted blanket on 32 adult subjects. They measured them via electrodermal activity, vital signs, and state trait anxiety inventory 10 with their exit survey. The results revealed that the use of a 30-pound weighted blanket in a lying position is safe, as evidenced by the vital sign metrics collected. Data obtained on the effectiveness revealed 33% demonstrated a lowering in their vital signs, lowering in EDA when using the weighted blankets. 63% reported lower anxiety after use, and 78% preferred using the weighted blanket as a calming modality. The next paper after this one talked about the continual afferent stimulation effects of weighted blankets, which is pretty much it's like a continuous hug while you're trying to sleep. Impacts your neurotransmitters, increases serotonin, increases your dopamine, your GABA, decreases cortisol, which is a stress hormone, and it decreases your heart rate, which can help you go to sleep. In this reference material, the doctor explains that weighted blankets in his practice have been shown to reduce signs and symptoms of anxiety. They have a positive impact on entrance to sleep time, as well as continual uninterrupted sleep time. It has the largest impact on children and adults in the ADHD or ASD spectrum, and it leads to noticeably less tossing and turning during sleep. So you should give yourself 7 to 10 back-to-back days using this method before giving up on it, and you should find a blanket around 10 to 15% of your body weight. This doctor also mentioned trying to find a weighted blanket that is made with a cotton fabric. So now I'm going to throw this in here myself, but I believe it is important to clarify here that you need to seek the advice of a doctor before starting any kind of therapeutic practice such as this, especially if you have any type of disorder like sleep apnea, hypotension, POTS, or persistent intermittent bradycardia. So continuous afferent stimulation. Afferent means sensation from your periphery to your central nervous system, so like being touched. Efferent means from the central to the periphery, so like deciding to move your arm. Weighted blanket equals a big continuous hug. This impacts your neurotransmitters and stimulates your vagal nervous system, which increases your serotonin. This plays a key role in your mood regulation, your sleep, your digestion, your nausea reduction, wound healing, bone health, blood clotting, and some sexual functions. It increases dopamine, which plays a key role in the regulation of movement patterns, memory, pleasure, reward, motivation, and mood regulation. It decreases your cortisol, which you can think of as a stress hormone, helps you wake up, be more alert, takes in information, regulates adrenaline, affects blood pressure and heart rate, affects metabolism and your immune response. And it does a lot more in the body, but we don't need to go in that in depth this time. So it also increases your GABA, which is an amino acid that acts like the primary inhibitory neurotransmitter for your central nervous system. This reduces your neuronal excitability, leading to reduced anxiety, reduced panic, improved sleep, can help treat ADHD and premenstrual syndrome or PMS, and assists in regulation of mood as well. and it decreases your heart rate, which is typically seen as a good thing, implying a more efficient heart function, better cardiovascular fitness, reduces sympathetic nervous system stimulation, and easier to sleep when it's lower, obviously, so your heart rate's not up like if you're going on a run. Average healthy would be around 60 to 80 beats per minute. Athletes may see even lower, sometimes down to the 30 beats per minute. I myself, if I wear a fitness tracker all day long, during the day I'm usually in the 50s, low 60s, and at night I get down to the mid 30s. So the next topic would be your deep pressure therapy. Deep pressure therapy can lower blood pressure, heart rate, improve your mood, and many more things. Reduce chances of a panic attack or a PTSD symptoms, and when you're using this, it can help with chronic pain disorders, pain from fibromyalgia, and reduces the amount of pharmaceutical painkillers that you typically need to take if this modality helps you with your pain. It can also help reduce grinding your teeth or bruxism if the cause is anxiety or stress. These things work together to help reduce blood pressure, help reduce heart rate, improve your mood, reduce your signs and symptoms of panic attacks, panic disorder, or PTSD, reduce chronic systemic pain disorders like fibromyalgia, can reduce the amount of drugs that you're taking. Example would be painkillers, anti-inflammatories, blood pressure medications, anxiety meds, heart rate medications. If this therapeutic modality helps with you and you've talked to your doctor about getting off those medications after being on this, like I said before, 7 to 10 days and actually getting good results. So seek your physician for those questions. And it can also reduce bruxating or grinding your teeth at night. I left all these links in the description for you to go peruse on your own time, but the first two really go really in depth, and then the other ones kind of talk about people's experiences. I also have a few YouTube videos linked below where a doctor other than myself talk about this therapy method. So I hope you guys learned something and you can put this into practice, and I'll see you guys in the next video.